I played a key role as chair of the African Union during the COVID period. We felt like we were beggars when it came to vaccine availability, when we felt we needed access to vaccines, and the Northern Hemisphere countries had bought all the vaccines in the world, and they were hogging them. And they didn't want to release them at the time when we needed them most. And we felt like we were begging. And at times it felt like they would just be droppings from the table, that yes, we will give you that and that. And let me tell you something that generated a lot of resentment. We resented that, and it got worse when we said we want to manufacture our own vaccines. And when we went to the WTO, there was a lot of resistance, enormous resistance. And we kept saying, what is more important, life or profits by your big pharmaceutical companies?
No more begging to address the health needs of the African continent. BRICS countries have come together to establish a Pharmaceutical Association. This pharma group will help the continent improve preparedness for future pandemics while enabling equitable access to life-saving medication. The Pharmaceutical Center comes on the back of the COVID-19 pandemic, which exposed Africa's wanting and fragile healthcare infrastructure. But after African leaders managed to secure the much-needed jabs for their citizens, a new challenge emerged. Countries were later faced with an alarming wasteful expenditure due to lack of proper storage facilities for the vaccines.
So the BRICS Health and Pharmaceutical Association is an association that has been called into existence. We'd be looking to launch on the fringes of the BRICS Summit, which will be happening in the next few weeks. The association has already drawn a number of eminent companies, businesses, as well as civil society and research associations in the area of health and pharmaceuticals from all of the existing BRICS countries. Very excited to announce that in anticipation of the BRICS community being extended, we have also now received a number of requests from countries on the continent of Africa, and particularly SADC, to also join. We've, as the Numalot Group, have done a fair amount of mobilizing within the SADC region and the continent specifically through a series of seminars that looks to address those illnesses and diseases that continue to plague the continent, but also those institutional aspects as well as institutions that begin to drive and facilitate expedited access to medicines and pharmaceuticals. And so very broadly, that is what the association will seek to do. Expedite access to pharmaceuticals, to medicines and medical devices for the benefit of not only BRICS, but in particular